I'm Tanya Ardoin from Lafayette Rock and Alternative. And the month of June is Vitiligo Awareness Month. And I just want to let you guys know that I also have vitiligo. I've been having vitiligo since I was seven years old. It started on my knees in little patches. And I guess it's the type where it's exactly, if you cut me in half, from head to toe, it's the exact same on both sides of my body. But so I was very interested to talk to you guys today. So welcome to the show, Dr. Pearl Grimes and Nick Goetz. And Neil, you have vitiligo too as well.
Yes, I do.
So Dr. Grimes, let's start with you. So can you explain what is vitiligo?
So Tanya, vitiligo is an autoimmune condition where cells of the immune system attack and destroy the pigment-producing cells in the skin, and these cells are called melanocytes. So once those cells disappear from the skin, you get a white patch. And that white patch is in stark contrast to the normally pigmented skin. And we live in such an aesthetically driven society, and these white patches can occur on any area of the body, the face, the trunk, the extremities, and they can be a source of tremendous emotional distress for patients given their visibility. This is a chronic condition. It can go through periods of stability, can go through periods of rapid progression. And today, given the fact that this is Vitiligo Awareness Month, I'm hoping we can dispel some of the myths associated with vitiligo. Number one, it's not contagious in any sense. And number two, it's not a cosmetic disorder. As I mentioned, it is a rather classic autoimmune condition, and it should be treated as we treat other autoimmune diseases.
Do you guys have any idea what causes vitiligo? Because you see, there's some people who I'm the only one in my family that has it. And then there's others where you see the mom and the aunt and the uncle, and it's more prevalent. So do you have any idea what causes vitiligo?
So Tanya, we know that for many patients, maybe 30, 40%, depending on whose study you're quoting, but we know there's a genetic predisposition. Vitiligo can run in families. It's not a dominant or recessive gene, but clearly there is a genetic predisposition. And we think patients who get it probably may well inherit what we call an immune susceptibility gene. So one person may get vitiligo, another person may get other autoimmune conditions. So there is that genetic predisposition. And so the immune system sends in lymphocytes, and the pathways are complicated, but to make it simple, lymphocytes are responsible for being the ultimate players in destroying the pigment cells in the skin. So our treatments have to turn that off so that pigment cells can regrow and repopulate the areas where they've been destroyed.
So Neil, let me turn to you. So tell me about your vitiligo journey. When did you?
Well, it started about 3 years ago when my dermatologist at that time saw the white patches spreading around my mouth and my forehead, and she directed me to Dr. Grimes. And Dr. Grimes did some tests, and she confirmed that I had vitiligo. And when she told me this, it just hit me like a ton of bricks. Now, I'm a cancer survivor, but somehow this vitiligo hit me in a different way, because when I looked in the mirror, I didn't see my cancer. Nobody saw my cancer, but people could see my spots. I could see the spots every day, and I was reminded. And I am in the entertainment business on the other side of the camera, and I'm often photographed on the red carpet. And I would look at the photos and I wanted to hide until I met Dr. Grimes, and she told me that she could help me. I burst into tears because I was so emotional. And we worked together and set a goal and came up with a management plan, and we've been sticking at that ever since, and I'm very pleased.
I can imagine it's probably harder as an adult since, I've been living since I was 7 years old. So it's like I've been kind of used to it. right now. Sometimes I even forget that I have vitiligo unless I run into a little kid. To me, little kids are always so vocal and they have so many questions. And they're like, what is that? Adults are pretty good at just like acting like nothing's wrong, like you're normal. And then you forget and then you remember when you see a little kid. So I can understand how it could be harder. So tell me, Dr. Grimes, what's the best way? What's some advice do you have for managing vitiligo? Because I'm definitely interested in hearing this because I've actually never talked with a doctor who specializes in vitiligo. I've never met one.
Well, we're so delighted to share to increase vitiligo awareness today with you. You know, for this event being, we're partnering with Insight. So in managing vitiligo, I think it's very important to find a physician with the skill set and expertise to diagnose, evaluate, and manage vitiligo. I think that's very important because vitiligo patients also have a higher incidence of other autoimmune conditions. So I think patients should also find a support group that, to be able to share your story with someone who has shared a similar journey. I think it is so, so important in managing not only the psychological burden of the disease, but management in general. You know, there's a website, this is vitiligo.com. As we increase awareness today, I think that website is such a tremendous resource for patients who want more information regarding vitiligo. There's also the resource nationally on that website of patients who have an expertise in this condition so that patients can seek out those individuals.
Oh, that is a good resource because it is hard to find a dermatologist that specializes in vitiligo because I have heard before, oh, it's only cosmetic. So a lot of people don't put any that much research into it. That's what I've used to hear. So I'm like, oh, well, I guess I'm just stuck like this. But thankfully for your website, maybe other patients suffering from or dealing with vitiligo, I guess, can get more information. Well, I really appreciate talking to you guys today. Some great information, and hopefully maybe someone else listening has vitiligo and they could be a good resource for them.
Thank you, Tanya.
Thank you.
Thank you. You guys have a great day.